Okay, imagine this scenario. You head out to the barn, right? And your pony, maybe your mini, or even your donkey just seems a little off. Not quite themselves. Maybe not really into their breakfast, a bit sluggish. Feels like, maybe just an off day, a little tummy ache perhaps. But what if that little sign, that lack of appetite, could actually be the start of something really serious, like a life-threatening emergency for them? Today, we're doing a deep dive into a metabolic disorder that can flip a seemingly minor issue into a real crisis for some of our equine friends. Equine hyperlipidemia, or sometimes called hyperlipemia, our mission today. To get a really clear, quick understanding of what this is, why it happens, how you might spot it, and crucially, how vets treat it and what you can do to help prevent it, we've pulled together insights from, well, some top veterinary sources to break down this complex topic.
Yeah.
Okay, so let's unpack this term first. Hyperlipidemia in horses. What exactly are we talking about? Is it just like a high cholesterol in people?
That's a really common question and a good one.
Yeah.
It's related to fats in the blood, yeah, but it's a bit more specific in horses and ponies and donkeys. So hyperlipidemia basically means elevated blood fats. Usually we're talking specifically about triglycerides or TGs, maybe above, say, 100 or 200 milligrams per deciliter. But the condition we get really worried about, the clinical syndrome, is equine hyperlipemia. That's when those triglyceride levels go through the roof, like over 500 milli-GDL. And it's not just high numbers. The animal is usually visibly sick, depressed, not eating, showing signs their organs aren't happy.
Okay, over 500. That sounds really high.
It is. But what's interesting is that slightly elevated lipids aren't always a disaster. You might see mild hyperlipidemia, for instance, in healthy foals that are nursing heavily. It can also be a normal finding in perfectly healthy donkeys or pregnant ponies sometimes. Their metabolism is just working hard.
Right.
But that clinical hyperlipemia, when they're sick and the numbers are sky high, that's a serious metabolic meltdown. And interestingly, foals can actually be born with it if the mare had it during pregnancy.
So while technically any horse could get it, it sounds like there are specific groups we really need to watch closely.
Absolutely. That's key. Ponies, miniature horses, and donkeys. They are, well, notoriously susceptible. They're the ones we worry about most.
Okay, ponies, minis, donkeys. Got it. So this is the really interesting part for owners. What actually causes this? What flips the switch?
Well, the absolute core trigger is almost always an imbalance between the energy the animal is getting in versus the energy their body needs. We call it a negative energy balance.
Okay, negative energy balance.
Think of it like their fuel tank running low. If they're not getting enough calories coming in, their body panics and starts breaking down its own fat stores really aggressively. Combine that with the fact that these specific breeds often have an underlying predisposition, metabolically speaking, and you've got the setup for trouble.
And how does that negative balance usually start? Is it just not eating?
Yeah, reduced feed intake or outright anorexia is definitely the most common trigger. There can be lots of reasons for that. Maybe they have another illness like a bad infection or colic or even pneumonia. Or it could be dental problems, making it painful to chew, or laminitis causing severe pain.
Right. Anything that makes them feel bad enough to stop eating.
Exactly. Stress is a big factor too, like
Mhm.
transport stress, moving barns, even social stress within the herd. And sometimes it can happen if feed is restricted intentionally, maybe for weight loss, but it's not managed carefully enough. Less commonly, it might be triggered by really high energy demands that aren't being met. Think late pregnancy, peak lactation, or even extreme cold weather if they're not getting enough extra feed.
Okay, so that energy gap happens, they stop eating enough. What's the next step? What actually goes wrong inside their body? Is it like a chain reaction?
That's a perfect way to put it. It's a dangerous domino effect. So first, the readily available energy stores like glycogen in the liver and muscles get used up pretty quickly when they're not eating. Then the body hits the panic button and starts mobilizing fat lipolysis from its adipose tissue, its fat reserves. This floods the bloodstream with huge amounts of free fatty acids, FFAs, and glycerol.
Okay.
Now, the liver tries to handle this influx. It can use some FFAs for energy or try to convert them into glucose, but the horse's liver just isn't great at this. It has a pretty limited capacity compared to, say, ruminants. So what happens instead? The liver starts rapidly taking up these FFAs and converting them into massive quantities of triglycerides. It packages these triglycerides into particles called very low-density lipoproteins, or VLDLs, basically little fat-carrying packages, and dumps them back into the bloodstream.
Ah, so the blood gets flooded with these fat packages.
Exactly. And here's the other crucial piece. In these susceptible breeds, ponies, minis, donkeys, there often seems to be a defect or a lower activity level of a key enzyme called lipoprotein lipase, or LPL. LPL's job is to clear these VLDL packages from the blood. If LPL isn't working efficiently, the VLDLs just accumulate, leading to those super high triglyceride levels.
So the fat packages can't get cleared out properly.
Right. And if the liver gets totally overwhelmed trying to process and package all this fat, the fat starts building up inside the liver cells themselves. That's hepatic lipidosis, or fatty liver. This damages the liver, impairs its function even more, and creates this awful vicious cycle because the high triglycerides in the blood actually suppress appetite further.
Wow, that sounds like a downward spiral.
It really is. And hormones play a role too. Insulin normally helps put the brakes on fat mobilization and helps LPL work, but stress hormones like cortisol, catecholamines, they do the opposite. They actually ramp up fat mobilization.
Okay, so beyond that issue with the LPL enzyme, who is inherently more likely to go down this path, which animals are just sort of set up for this risk?
Yeah, there are definite predisposing factors. Obesity is a huge one.
Makes sense. More fat stores to mobilize?
Exactly. And obese animals often have underlying insulin dysregulation or insulin resistance, IR. This is a major risk factor because insulin is so important for regulating fat and glucose metabolism. If it's not working right, fat mobilization can run unchecked.
So IR is a big player here.
Very big player.
Yeah.
Then, as we've said, the breed predisposition is critical. Ponies, miniature horses, donkeys.
Mm.
They just seem genetically geared towards this, often linked to that tendency for insulin resistance. You also see connections with equine metabolic syndrome, EMS, in breeds like Arabians, Morgans, Welsh ponies. That genetic component can contribute.
Interesting. Any other factors?
Sex seems to play a role. Females, mares, genets, particularly during late pregnancy and lactation when energy demands are high, seem to be at greater risk. And then there are concurrent conditions. Older horses with PPID, Cushing's disease, are more susceptible, especially if they also develop diabetes mellitus alongside it.
Right.
Interestingly, the medication used to treat PPID, pergolide, can sometimes actually help improve the hypertriglyceridemia. And just general stressors, endotoxemia from infections, even heavy parasite burdens can increase risk.
So with all that complex stuff happening inside, what might an owner actually see? What are the outward warning signs?
Yeah, this is where it gets tricky because the clinical signs are often really nonspecific and vague, especially early on.
Not obvious then.
Not at all. They often just look like signs of whatever caused the horse to stop eating in the first place, Or maybe signs that organs are starting to struggle. So early signs you might notice are just general depression, being lethargic, definitely that anorexia or reduced appetite, which, remember, is both a cause and a consequence.
The vicious cycle again.
Exactly. Maybe some general weakness or even trembling, just looking really dull and unwell.
Okay, so pretty general sick horse signs initially. What about as it gets worse?
As it progresses, or if organ dysfunction kicks in, you might see more specific things. Ventral edema, that's swelling under the belly, the chest, down the legs. It happens when fluid leaks out of vessels, often a sign of severe systemic illness. They might show signs of colic, abdominal pain. Sometimes it's mild, maybe just from the liver swelling and stretching its capsule. If the liver failure gets really bad, you can see neurological signs. That's hepatic encephalopathy.
What does that look like?
Things like head pressing against a wall, aimless wandering, being unsteady or ataxic, apparent blindness, being really out of it, stuporous, or even, in severe cases, convulsions.
Wow, that's serious.
Very serious. You might also see jaundice or icterus, that yellowing of the gums, the whites of the eyes, sometimes the skin. That points to significant liver dysfunction, although it's not always present. GI signs can vary, maybe diarrhea, maybe constipation. Sometimes you see really fatty, foul-smelling feces. It's called scatorrhea. And despite often starting out obese, they can lose weight rapidly because their body is just burning through those fat stores uncontrollably. Oh, and specific things like pregnant mares might abort. Or if PPID diabetes is involved, you might see increased drinking and urination. Foals born with it, though, they often look normal right at birth.
Okay, so the signs start vague but can get pretty severe and specific. Given that initial vagueness, how do vets actually nail the diagnosis? How do you confirm it's hyperlipidemia?
It really takes a combination of, well, suspecting it based on the breed and the clinical signs, and then getting laboratory confirmation. But there's often a really quick, almost instant clue right there in the clinic or barn.
Oh, yeah.
It's the appearance of the blood plasma, or serum itself. When you draw blood and spin it down in a centrifuge, the liquid part, the plasma or serum in a horse with hyperlipidemia, will look incredibly milky, cloudy, or even like cream.
Seriously? Like you can see the fat?
Oh, yeah. It's called lactescence.
Mm.
In really severe cases with TGs over 500, you literally cannot read newsprint held behind the tube of serum. It's that opaque.
Wow.
So seeing that milky serum is a very, very strong indicator. Gives you a presumptive diagnosis pretty
But
quickly.
you still need the actual numbers, right?
Absolutely. The definitive diagnostic test is measuring the serum triglyceride concentration. Markedly elevated levels confirm it. Hyperlipidemia may be over 100, 200, but true clinical hyperlipemia is generally defined as over 500 milligdl.
And normal is way lower.
Way lower, like maybe 11 to 65 milligdl for a typical adult horse. So we're talking massive increases. Other blood work helps fill out the picture. We often see elevated non-esterified fatty acids, the NEFAs. Blood glucose can be tricky. It might be low, hypoglycemia, or normal, or even high if there's significant insulin resistance. Liver enzymes, GGT, AST, SDH, ALP, and bile acids will likely be up if there's hepatic lipidosis. Kidney values, creatinine, and BUN might be elevated if the kidneys are affected too. Electrolytes can be deranged. In severe liver failure, blood ammonia might be high, and clotting times might be prolonged. Urinalysis might show ketones, another sign of fat breakdown.
And imaging, can you see the fatty liver?
Yes, an ultrasound can often show liver enlargement or changes in its texture suggesting fat infiltration. And if needed, a liver biopsy is the gold standard to actually see the fat droplets within the liver cells. We can usually do that standing, guided by ultrasound.
Okay, so you get the diagnosis, maybe you see that milky serum, the high TGs. What does this all mean for treatment? This sounds like a real emergency. What do vets do?
You're absolutely right, it is an emergency. Treatment has to be immediate, aggressive, and hit multiple targets. The main goals are 1. Reverse that negative energy balance, that's paramount, get calories in. 2. Reduce the triglyceride levels in the blood, get that fat load down. 3. Treat the underlying primary disease, whatever started the anorexia. And 4. Provide supportive care for any organs that are struggling, especially the liver and kidneys.
So number one, reversing the negative energy balance. How do you do that safely?
Aggressive nutritional support is the cornerstone. If the horse's gut is still functioning, even partially, we want to use it. Enteral nutrition feeding via mouth, or more likely, a nasogastric tube is preferred, will offer palatable, easy-to-digest, high-energy feeds, but crucially, they need to be relatively low-fat, especially at the beginning. Think soaked Timothy hay pellets, unmolasted beet pulp, senior feeds, maybe some oats.
Low fat. Okay. That
Yeah.
seems counterintuitive when they need energy.
It does, but adding more fat early on can just worsen the overload. You want easily usable energy sources first. If they absolutely won't eat voluntarily, nasogastric tube feeding is essential. We mix up slurries, often using dextrose for energy, a fiber source like psyllium, and protein, and administer them directly into the stomach. Small, frequent feedings are key, maybe every 4 hours, around the clock sometimes.
And what about IV fluids?
Absolutely critical.
What?
Especially intravenous glucose or dextrose. We give this as a continuous rate infusion, often 5% or 10% dextrose, in a balanced electrolyte solution. This does a few vital things, provides immediate energy, helps combat hypoglycemia if it's present, and most importantly, it stimulates the horse's own insulin release.
Ah, and insulin helps stop the fat breakdown.
Exactly. Insulin is powerfully anti-lipolytic. It tells the fat cells to stop releasing so much fatty acid. It also encourages cells to take up glucose and helps that LPL enzyme clear triglycerides. We have to monitor blood glucose very carefully during dextrose infusion, though, to make sure it doesn't get too high.
So you mentioned stimulating their own insulin. Do you ever give insulin directly as part of the treatment?
Yes, we often do. Insulin therapy can be a very effective tool. As we said, it's a potent hormone that shuts down fat mobilization and promotes triglyceride clearance by activating LPL. We typically use regular crystalline insulin, either as a constant rate infusion, an IV drip, or through frequent intramuscular or subcutaneous injections. But, and this is really important, it requires intensive monitoring. Blood glucose needs to be checked constantly, sometimes every hour or two initially, because the biggest risk is causing severe hypoglycemia, low blood sugar.
Right. You need to balance the insulin with the dextrose.
Precisely. You also need to monitor potassium levels, as insulin can drive potassium into cells and cause hypokalemia. So dextrose infusion must be maintained alongside insulin therapy.
Are there other things you use to lower the triglycerides?
There are a few adjunctive therapies. Heparin is sometimes used. It's an anticoagulant. But at low doses, it also helps release LPL from blood vessel walls, potentially increasing its activity and helping clear triglycerides faster. However, you have to be cautious because of its blood thinning effects, especially if the horse might need surgery or has clotting issues already. So we monitor clotting times if we use it.
Okay. And then there's treating the underlying cause and supportive care.
Absolutely vital. You have to identify and aggressively treat whatever made the horse stop eating. manage the colic pain, treat the infection, deal with the laminitis, fix the dental issue. Fluid therapy is crucial for hydration and correcting electrolyte imbalances. We provide liver support, often with B vitamins. Other liver protectants are sometimes used, though the evidence for them isn't always strong. Anti-inflammatories like Flunix and Meglumin help manage pain and inflammation. If hepatic encephalopathy develops, specific treatments like lactulose might be needed. We manage kidney issues if they arise. And just generally trying to minimize stress for the animal is important. Oh, and it's worth remembering things we avoid, like we never give insulin if the horse is already hypoglycemic without providing glucose first. We avoid heparin if surgery is likely. And corticosteroids are generally a bad idea as they can worsen insulin resistance and fat mobilization.
Wow, it sounds like incredibly intensive care. So, with all that effort, what's the actual outlook? What's the prognosis for these horses? And maybe the most important question for owners, how do we prevent this nightmare in the first place?
Yeah, the prognosis, it can be tough. For horses with severe established hyperlipemia, especially if there's significant fatty liver and organ failure already present when treatment starts, the prognosis is often stated as guarded to poor.
That sounds discouraging.
It can be. Historically, mortality rates reported in severe cases were quite high, sometimes 60%, even up towards 85 or 100% in some studies. It's a very serious condition. But, and this is a really important, but early intervention makes a massive difference. If it's caught early, diagnosed promptly, and treatment is aggressive and sustained, the chances of survival improve significantly. The advances in treatment, especially the more widespread and refined use of IV dextrose and insulin therapy, have definitely improved the outlook compared to, say, 20 to 30 years ago.
So catching it early is key.
Absolutely crucial. Don't wait if you have a susceptible animal that goes off its feed.
Which brings us to prevention. What are the main strategies?
Prevention really boils down to managing the risk factors we talked about. Number one is careful weight management. Avoiding obesity in those at-risk breeds, ponies, minis, donkeys, is paramount. Especially for mares going into pregnancy, aim for a healthy body condition, not overweight.
Okay, manage weight.
Number two is avoiding prolonged periods of fasting or severe negative energy balance. If you need to restrict feed, do it gradually and carefully, ensuring they still get adequate nutrition. Don't let them go without feed for extended periods if you can help it. And number three, tying into catching it early, is prompt veterinary attention for any illness that causes anorexia in these susceptible animals. If your mini horse stops eating because of colic or your donkey seems depressed and off feed, don't just wait and see for several days. Get your vet involved quickly because that anorexia could be the trigger for hyperlipemia starting.
That makes perfect sense. Prompt action is key. It really is quite something, isn't it? How a seemingly simple thing like refusing a meal can trigger this whole complicated, dangerous metabolic cascade, especially in these specific types of equids. It's a powerful reminder of how finely tuned and interconnected these biological systems are.
It absolutely is. And, it kind of makes you think, it raises an important question, maybe for everyone listening to consider. What other common behaviors or maybe subtle signs we see in our animals might actually be just the tip of an unseen serious metabolic iceberg lurking beneath the surface?
That's a really provocative thought to end on. Definitely something to keep in mind that critical observation and getting help early can truly make all the difference. Thank you so much for joining us for this deep dive today. We really hope this was helpful, and we invite you to keep exploring the hidden complexities of the world around us.